on behalf of Robert Wood Johnson University Hospital, Somerset, in collaboration with Friends Health Connection, I'm Serena Collado, Director of Community Health here at Robert Wood Johnson University Hospital, Somerset. And today we're going to be talking about weight loss and if bariatric surgery is an option for you. Over the past few decades, Americans' waistlines have been getting bigger and bigger, leading to an obesity epidemic. Nationwide, about 1/3 of adults are considered obese, and here in New Jersey, about 1/4 of adults are obese. For some people, diet and exercise just don't work. That's when weight loss surgery may be an option. We're joined today by Dr. Angela Glasnapp, a bariatric surgeon at Robert Wood Johnson University Hospital, Somerset, a Robert Wood Johnson Barnabas Health facility. Thanks for joining us today, Dr. Glasnapp.
Thank you so much for having me.
Let's start by defining for our viewers what we mean by we have someone that has obesity.
So I think the first thing that's really important to realize is that obesity is, in fact, a disease. And the American Medical Association classified obesity as a disease just a few years ago. And obesity is a disease of hormone imbalance in many people, and it does affect every part of their body, literally from their head to their toes. It's a disease of hormonal imbalance, of abnormally high fat storage, that despite many efforts with diet and exercise, people sometimes need more of a treatment to help combat it.
Thank you. So what are the health risks that are associated with obesity?
Sure. I think it's very important to realize that obesity does, like I said, affect every part of our body from our head to our toes. So if people, for example, wake up with headaches frequently, that could be a sign of increased pressure in the brain from being overweight. Obviously, obesity can increase your risk for diabetes and heart disease. Some of the less commonly known risks of obesity are, one is a risk of developing certain cancers. There are many different cancers, from ovarian to breast cancer, colon cancer, that are associated with obesity. The list really goes on and on. Your liver can be affected. People can develop cirrhosis from obesity. Infertility in men and women has been associated with obesity as well.
Oh, wow. Yeah. So can losing weight actually improve your health then?
Absolutely. One of the most exciting parts of my job and of our job here at Robert Wood doing bariatric surgery is the fact that one surgery, which takes potentially 45 minutes, can actually reverse many different diseases, have people stop taking many of their medications. So bariatric surgery does have many health benefits in helping to improve a lot of the diseases that I just mentioned that are associated with obesity.
Okay. So as we see, for some people, repeated attempts at diet and exercise just don't work, and their excess weight has caused some serious health issues. In those cases, these individuals may be candidates for weight loss or bariatric surgery. So Dr. Glasnapp, who is an ideal candidate then for bariatric surgery?
Right. So part of the screening process does involve obviously meeting with the patient, having a consultation, speaking with them, making sure that their obesity is not the result of some other treatable condition. Once we've established that, then we discuss and make sure they have tried other things. Obviously, surgery is not always the first choice. Many times diet and exercise, we say they don't work because we said obesity is a hormonal disease. Bariatric surgery can actually help combat that, unlike diet and exercise. But in order to qualify for bariatric surgery, you need to have a certain weight limit, a weight requirement. So it starts at a BMI of 40, and BMI stands for body mass index, which is a ratio of somebody's weight to their height. So a body mass index of 40 or greater will qualify you for surgery. Or if you have a BMI of 35 or greater with an obesity comorbidity, such as sleep apnea, diabetes, high blood pressure, then you may qualify. And when we say qualify, we mean that you can have the surgery and also that insurances are more likely to cover it.
Okay. So who's actually involved in the evaluation to determine if an individual is eligible for surgery?
Sure, great question. Obviously, you'll meet with the surgeon. The patient will meet with the surgeon and have a one-on-one initial consultation. And then the patients will also meet with a nutritionist and a psychologist as well.
Oh, wow. So it is like a multidisciplinary almost approach.
It is. And there are several tests that are involved preoperatively, which the surgeon and the patient will discuss at that first visit. And at a minimum, blood work is required to make sure that there are no underlying issues. Chest x-ray, EKG, the psychological evaluation that we spoke about. Some people will need more cardiac testing, such as a stress test. What's very important is that we speak with the patient's primary care physicians and whatever specialists they see to make sure that everybody is on board. This is an elective procedure, so we have the benefit of time to make sure that everybody's conditions are adequately treated and that it's safe for them to undergo surgery.
Oh, that's great. So we know that bariatric surgery has actually changed dramatically over the years from an open procedure to one that is now performed laparoscopically using very small incisions. So can you give us an overview of the surgical treatment options?
Sure. First, it's great that you mentioned how it's changed so much. I think back in the 70s when bariatric surgery first came about, and even the 80s, and it was performed with a very large incision, bariatric surgery got a little bit of a bad reputation because there were some complications associated with that. Now that we do these surgeries laparoscopically or with very small incisions, it has become very, very safe. And one of the main reasons is because patients have very little pain or discomfort after the surgery since the incisions are so small, and that enables them to get up moving around the same day of surgery, which really limits the amount of potential complications that they can suffer from. When we talk about the bariatric surgeries that have been performed and that are still performed, the sleeve gastrectomy and the gastric bypass are two that are most commonly performed today. And the sleeve gastrectomy is actually a procedure where we remove about 75% of a patient's stomach. So if you can visualize, before surgery, a patient's stomach is about the size of a football. After the sleeve gastrectomy, it looks like a banana. The word sleeve is a misnomer. It implies that we would put something in a patient's body, but we actually don't. We just are removing about 75% of their stomach. And the reason why this works is because, yes, they can eat less, but more importantly, the hormones in the body that affect hunger and satiety or the feeling of feeling full are affected in a positive way after this procedure. So that's the sleeve. The gastric bypass is a little more involved. That's a surgery where we divide the stomach, create a small pouch, but we also cut and divide the small intestines and reroute them, thereby creating what's called a malabsorptive limb, or a part of the intestine whereby whatever the patient eats, not all the calories are absorbed. So those are the two most commonly performed surgeries today for weight loss. They do affect hormones, which make patients less hungry. There's a third procedure that many patients ask about still, and that's the gastric band. That became popular in about the 1990s, and that involves a device that is placed around the top part of the stomach that essentially just cinches the stomach down, making people feel full faster. We have found that it does not have the same positive hormonal effects on hunger that the sleeve and the bypass do, and it requires a lot more follow-up. So essentially, that procedure is not being performed as commonly. I think it's less than 5% of bariatric procedures in this country now.
Very interesting. So what should patients consider in choosing which type of weight loss surgery is right for them?
Right. So that is something that we discuss at their first consultation. And we as the surgeons try very hard not to tell the patients which surgery to have. We think it's very important for them to make this choice on their own with the knowledge that we can impart about each surgery. If there's a particular reason why one surgery is better for somebody health-wise over the other, of course we will let them know that. But I think it really just depends on which procedure fits best with the patient and with their families and their discussion about it.
Okay, that's fair. So how much weight loss then can a patient actually expect to lose after a weight loss surgery?
Right. So let's start by just saying the statistic for diet and exercise alone, we know that 1% of people will keep off the weight that they have lost long term. And we compare that to 75% of patients who have either the sleeve or the bypass that keep off most of their weight long term. And when we talk about how much weight they can lose, it's very similar between the sleeve and the bypass. We talk about in terms of excess weight loss. So patients who have those procedures can lose between 65 and 70% of their excess weight. So if somebody has 100 pounds to lose after these surgeries, they can be expected to lose between 65 and 70 pounds in the first year. There is a range. It does depend on many factors. It depends on how the body responds to the surgery. It depends on how dedicated the patient is with their behavior changes, how much they follow up. So there are a lot of factors, but I think it's fair to say that patients can lose between 60 and 70% of their excess body weight with the sleeve or the bypass. The band is a lower amount, it's about 40%.
Okay. So after a surgery, what follow-up care is actually required?
Sure, follow-up is key, both for the safety of the patient and for long-term success. So we see our patients 1 week after surgery. Let me back up, they do stay overnight. So for the sleeve, you would stay overnight for 1 night in the hospital. The bypass would be 2 nights. Then we see you 1 week after surgery, then 1 month after, and every 3 months for the first year. And we do encourage patients to come back two times a year at a minimum after that, just to reinforce positive behavior, to make sure that no nutritional deficiencies have developed. So we do obtain blood work at 3 months after surgery and then again 1 month after. And during these visits, they also meet with the nutritionist as well. There are support groups that we have at all of our office locations, which I think are very important for patients if they're willing to attend, to just speak to other patients who have had the surgery as a positive reinforcement.
Okay. So in the beginning of our conversation, we talked about how many patients opt for bariatric surgery because they have health issues. So what are some of the health benefits of bariatric surgery?
Right. So as we mentioned, diet and exercise really not working. And the reason is because it's counterintuitive. When you restrict your caloric intake, when you eat less, your body actually works against you to try and defend its weight. And the hormones change in such a way that anyone who's been on a diet, you know that you're hungrier. And the second you go off that diet, you gain whatever weight you lost back plus more, right? So bariatric surgery helps to break that vicious cycle, and it helps your efforts not be in vain. So once you have bariatric surgery, your hormones change so that your efforts allow you to lose the weight. Once you start losing the weight, even just 5% of your excess weight, there are health benefits. Your blood pressure improves, you sleep better, your sugars are better controlled. I've had a patient who had severe back pain. She even had a spinal stimulator put in. And after the surgery, just within a few weeks, her pain was improved because I think she was eating cleaner and eliminating a lot of the toxic foods that we so often eat. And the surgery makes it a lot easier for patients to adhere to those diets. And the hormonal changes allows the weight to come off so that most of their obesity-related diseases are improved.
Oh, that's fantastic. So I know there probably are some skeptics out there and are concerned.
Sure.
Can you maybe speak to what are the risks of, those who are involved with bariatric surgery?
Absolutely. Absolutely. And again, it has become a lot safer over the years with the laparoscopic approach. And in fact, bariatric surgery has become one of the safest surgeries performed. I'll just preface this by saying that it's even safer than having your gallbladder removed. But that being said, it is surgery. So obviously there is always a risk of bleeding or infection. Sometimes patients have heard of something called a leak, where with both the sleeve and the gastric bypass, there are areas of the stomach where we have divided it, that if it doesn't heal properly, the gastric juices can leak into the abdomen and cause an infection. This is something where patients will know something's wrong, they just won't feel well. So communication is of utmost importance with the surgeon. So if they don't feel well, they'll call and we'll diagnose it and we'll fix it. It's not life-threatening if detected early. Other less severe risks, maybe some heartburn after the sleeve. We need to monitor after the bypass in particular for any vitamin deficiencies. So patients will be on multivitamins after these surgeries, as well as protein supplements. But for the most part, it's very, very safe.
That's great.
Yeah.
So what are the keys to successfully keeping the weight off after surgery?
Sure. So we talked about follow-up, and I think following up with your surgeon, with your nutritionist, with other patients, with support groups, I think that is the key. Recognizing that bariatric surgery is just a tool. It's a treatment option for this disease of obesity, which patients, even after they have the surgery, still have to realize that they have the obesity gene, and so they have to take it day to day. Patients who realize this is not just a quick fix and really implement this as part of an entire lifestyle change, they are the most successful. And following up with us, we reinforce these things at each visit.
Oh, that's great. So without naming patient names, can you share some of your success stories with us?
Sure. Do you have 3 hours? No. So it's very hard to pinpoint just one success story. And we are very passionate about what we do, because with, like I said, this one surgery, it can affect so many aspects of patients' lives, and nothing is too small. So for example, patients can cross their legs comfortably after losing the weight. They can sit comfortably on an airplane and not ask for a seatbelt extender. I had one patient who always wanted to jump out of an airplane but never could because of his weight. He did that, and that was awesome. I had a patient recently who was struggling. She and her husband were struggling to get pregnant. She had the surgery. She waited the year that we require to try to get pregnant, and she had a miracle baby. She got pregnant after losing the weight. So that was very, very exciting. So there are many successes, and none are too small.
Well, thank you so much for joining us today, Dr. Glasnapp, and doing all you do to make the community healthy.
Thank you so much.
If you are interested in learning more about bariatric surgery, please go to our website at www.rwjbh.org/weight loss, or sign up for one of our free monthly bariatric surgery seminars by calling 1-888-724-7123. Thank you all for joining us today.